How does your solution improve oral health and overall health? And as much as you can quantify the outcomes your solution drives as possible too.
So UptimeHealth, we help people manage and keep up and running their equipment that takes care of the patient. So we see healthcare as a combination of a patient, a provider, and an instrument or a device of some sort. Healthcare really isn't provided without that third variable. When was the last time you got an X-ray or a dental X-ray without a dental X-ray machine like a CBCT? So these things need to be calibrated, up and running, in quality to produce quality outcomes. So other companies can actually run their AIs and everything on top of it. So what we're looking to do is solve that variable where people don't really understand how to take care of their equipment in these environments by giving them a tool that automates based on what they own, the things that they need to do to take care of it. And if it does break, they can dispatch service from our marketplace. And our system is mining the data as it happens. So we can now do things like predict failure events, know cost of ownership in the future year of the device, and help them forecast when they should get rid of problematic machines before they become problematic and disrupt patient flow. Because at the end of the day, we see that as a big access problem. And the further these offices are away from a technician community or a large, densely populated area, the harder it is to get somebody out there to fix it and repair it and put it back up and running so people can get the care they need. So if we can reduce those moments, we can increase access as well as make sure that everyone's getting proper care.
We are really looking to find the solutions that are built to scale and that would have that transformative impact. So when your solution is at scale, it's widely adopted at scale, what's the impact you would see on patients, care teams, education, and or payers? Some of these segments may not be part of your customer group, but we're making this harder now. It's only 60 seconds. And so what is the impact? What is the change you would enable in the ecosystem for any of those segments when your solution is widely adopted?
At scale, we already have over 2,000 practices utilizing our software and over 5,000 utilizing our services for at scale, what we're doing right now. But for the way we see it impacting the industry when we're fully deployed and well throughout.
What does that look like? What does fully deployed mean? Like, that's a good question. Define what scale looks like. Erica said everybody should have a toothbrush, a Great Gums toothbrush. I don't know, maybe you should expect something in the mail from Erica if that's what everybody on this webinar. But what does scale mean for you?
So for us, scale means like having at least 10% of the industry participating in our software because the data set underneath it was really powerful for everybody that's involved. But going back to, somebody mentioned this earlier, the medical dental integration that's happening, our company right now is poised to help that transition. So we do is we also manage compliance efforts related to the machines in your practice, which is already mandated and regulated in medical. So if you're ever going to combine these two offerings, you have to have a better solution for the compliance and equipment management that you're going to do, and we will facilitate that. The other thing is with our data, when it's at that scale, we can predict things like failures, which will then also predict purchase, which we can get that information to distributors to make sure they have things on hand to give to the offices to reduce lead time. We can also give information back to the manufacturers that are helping them understand what issues are happening in their machines, because right now they don't even know what fails in their machines. As weird as that sounds, that's all blocked at the distributor level. So we can elevate that information to the manufacturers to make improvements and therefore impacting the whole entire healthcare vertical. Better products, more available in the offices to facilitate the innovations we see here.
What is the one thing that you need to reach that exponential impact in your organization? Or what is the one ask you have from our audience? You can't answer both questions. It needs to be one sentence or one word.
Education, I think, echoes everyone else here. People need to understand equipment is a core part of healthcare, and providing it and protecting it's going to protect our care.